today what we're going to do is show you how to tape for knee pain using kinesiology tape. You might have seen this on the athletes in the Olympics and a number of elite level athletes using kinesiology tape. It's actually a stretchy tape. So you've probably seen a number of athletes on TV or elite level athletes wearing this tape and wondering what it does. So by applying the tape, it can slightly lift the outer layer of skin, which helps to improve circulation and blood flow to that area. So we can use it over painful areas as well. What I'm going to show you today is a tape job for somebody who has pain on the underside of the knee. So you'll see this tape job a lot in runners or cyclists. So what we're going to do is we're going to start with the knee in a bent position. We're going to measure out the tape so that it crosses the top of the thigh and the bottom of the shin bone. Now, because the knee is in a bent position, when we apply the tape, we don't need to add any stretch because the tape already has some stretch in it. What I'm going to do is round out the tape edges that just prevents the tape from lifting off at the edges. We're going to tear the tape like a Band-Aid. Try not to touch the tape as it'll lose some of its stickiness. So we're going to start from here. You want to follow the contour of the kneecap. Again, I'm not adding any stretch to the tape, and you can just finish on the other side of the shin bone there. Now, if you go a little bit too far, it's not that big of a deal. So I've measured out the tape there as well. Again, rounding out the edges. Now this tape is quite sticky, and that's the difference with this type or brand of tape, that it can stay on for actually up to 5 days. So you can use it for multiple training activities, and you can go in the shower with it. You just want to make sure that you pat it dry as opposed to rubbing it dry so that the ends don't lift. So another important feature is you want to make sure that you start and finish on skin, not on tape. That's going to help the tape stay on for a little bit longer. Following the contour there, no stretch on the tape, and just finishing on the opposite side. You can give it a little bit of a rub just to activate the adhesive. Now, I was telling you before that this person has come in with some inferior or below the kneecap knee pain. So what I'm going to do, this is where I am going to add some stretch to the tape. So we talked about that skin lifting effect before, where the tape, as it adheres to the skin, lifts the skin slightly, which helps to create blood flow. So we'd like to increase the blood flow to the painful area. So I'm going to tear the tape in the middle this time. I'm going to add approximately a 50% stretch. I'm going to lay it over the area that's painful, and then I'm just going to lay the ends over there. Now, when we're finished the tape job, Dave, if you just want to straighten your knee for a minute, you can see that it kind of looks like he has a bit of a fat knee there. That's the skin puckering effect, so the tape lifting the skin slightly away from the under layers, which helps to create some blood flow. So Dave can leave this on for up to 5 days and do any of his regular training activities. So again, that's going to increase his awareness of where his knee is in space.